A virus is something like a different species. It is no way, it may be a microorganism. It is not bacteria. Antibiotics are only for bacteria. Suppose I take antibiotics for a virus. My sore throat, which is full of virus, is causing a redness and flaring and pain and all those things. It is very natural for me to think, oh my God, there is so much of infection, and then I pop in an antibiotic. Now, this antibiotic, which is actually doing more harm than good, is out of your control when you take it. It kills all the good bacteria of the throat, which are fighting along with the virus to occupy that space in the throat and come back to normal. You are killing them and making the virus grow more, or say any other bacteria which is resistant to this particular antibiotic grow there. I have a lot of patients who have got, because of repeated burps, they have got the bacteria of the intestines coming into their throat. Example, Klebsiella, E. coli, which are supposed to be enteric bacteria, which are supposed to be in the aboral side, are coming up and colonizing just because you take antibiotics to kill the most beautiful, sensitive streptococci, which is to be there, which is duty to be in the throat. Don't pop in antibiotics, especially azithromycin. Azithromycin makes you resistant for most of the antibiotics like ampicillin, amoxicillin, clavulanic acid like augmentin, as you know, basic sporidex, first generation cephalosporins, and you are in for a lot of trouble because you are left with nothing but injectable antibiotics. The higher you go, I have so many patients who come first time with a multidrug resistant strain in urinary tract infection. You ask them how come it's so resistant, they have no clue, but take their history. They have popped in erythromycin for every small fever, or 2 days of doxycycline, 3 days of ampicillin, or 2 days of azithromycin. Crazily, they pop in at least twice or thrice a month antibiotics and become very resistant, and they themselves succumb to these infections, which is getting worse. So, when do you take antibiotics? It's very clear. Persistent fever beyond 5 days, persistent infection beyond 5 days, a sputum becoming yellow from whitish, not yellowish, properly yellow, and a foul breath smell starts coming with the sputum whenever you cough. Then you have cough which is now becoming serious issue, which is inconsistent, or say you are bringing a lot of sputum with that, and spiking fever. Fever is the only indication after 5th day where we give antibiotics. That also out of prescription. Please see a doctor instead of seeing a pharmacist. A lot of our patients go directly to the medical shop, like big doctors, they themselves ask for azithromycin for 3 days, ampicillin for 2 days. Don't do that. The Government of India is trying to bring some regulations. Follow those regulations. Over-the-counter antibiotics are not good. Please see your doctor. Spend some time before you are given antibiotic. Question whether it is necessary. Don't fuss on the antibiotic prescription. Don't force a doctor to write a prescription of antibiotics. You are not a doctor. Please allow the doctor to do the justice to his duty and then give you antibiotics. Only then you take an antibiotic.